Recording on. Screen share. Okay, so just so you guys know, when I've got my screen share up, I can't actually see the chat box at all. So what I'm going to do, last week it was all kind of coming from every end at me. So what I'm going to do is every couple of slides I'm going to stop. I'll find an appropriate spot, go to the chat box and see if there's any questions there. So they may not be answered immediately, but we'll just backtrack and I won't move too far ahead. So we're following on from last week. So we looked at normal gait last week. Tonight we're going to start with the postural assessment. So when you're doing your gait assessment, you probably start with posture, just because the dog's going to walk into your room and be stood there for a few minutes. And what we want to be getting out of tonight is the importance of looking at a dog in a number of different positions. It's not just about one. Knowing what normal static position is going to look like, and starting to get our head around a bit more around compensatory postures as well. Now, we can't obviously go through every single postural possibility ever, in all honesty, because every dog is going to compensate differently depending on the medical problems, and their own comfort zone and how they feel will totally depend how they're going to compensate. And I can't say that a week goes by that I don't see dogs throwing some whole new compensatory pattern or posture at me. But what you should be able to identify is a dog that's compensating, because you'll know what normal posture looks like, and then we can then compare that and see what abnormal posture looks like. So the positions that we tend to use, we're going to use the stand, we're going to use the sit. You can use the down. For me, I don't use it a huge amount, but there's still valuable information to be gained from it, particularly if you're not sure, if you need that third position just to kind of confirm something in your head, then I'd certainly go looking for it, or if you want to see if it presents in that position as well. Obviously, we're increasing hip flexion, weight shifting changes quite a bit as well. So if you're kind of running along a train of thought and you think, you know what, if you can't sit or lay down properly, then that's kind of going to really confirm what I'm thinking, then by all means use it. But for the most part, we're probably just looking mainly at the sit and stand. We're never going to force them into a position for assessment, and they need the option to refuse. That's really important, that the dog can say, you know what, I don't want to do this. I'm not comfortable. I'm not happy. It could be that they're not happy in the clinic, or it could be that it's a really painful position for them. And that's something as a therapist that we need to be able to decide in our heads whether or not we've got a behavioral issue or whether or not we've got a medical issue stopping this dog from assuming a position. If needed, if you think it's a behavioral reason, maybe the dog's not comfortable, then your owners can always get video or photos at home. If you review in clinic, they can email them, WhatsApp them, however they send them, they can get them to you. And the main reasons that we want to look through these different positions is in a stand, we're going to see how the dog is balancing and carrying its weight. Is it weight shifting evenly across the body? The sit, we're going to be looking more at kind of flexion, extension in different joints. And again, its ability to maintain balance in those positions. So, and this list is not exhaustive by any means, but in a stand, I want to look at head carriage, head height. Can the dog hold his head up higher, or is he sitting with it quite low around shoulder height? Where are his feet? Can he stand square? And when he is standing, are the joints aligned with one another, or do they kind of stick out or rotate out from different areas, particularly elbows and knees? I want to look at the shape of the dog, the position of the back and spine. Is he got quite a flat top line, or is it sagging a bit, or is it roaching? Is he triangular shaped? Is he weight shifting forward or backwards? Does he have any areas that look a bit thin, where others look quite heavily muscled or almost fat? Tail carriage, is it balanced, or is he having to hold it to one side? We're going to look at symmetry of bony landmarks. Primarily, we tend to find these through the joints. The pelvis is another good one, and shoulder blades. As I said before, any rotations, elbows, stifles sticking out, foot placement, is everything square, is something rotated a bit? And in that foot placement, we're going to look at how they're putting their weight through the feet as well. And importantly as well, can he maintain it? Just because we can walk the dog forward and ask him to wait or stand, and they can do it for 5 seconds, can he do it for 10 or 20, or does it become uncomfortable and they start weight shifting and kind of shifting themselves about a bit? And when you're looking at a dog from an alignment perspective, this is what we want them to look like. So I've popped those red lines in to kind of give a bit of alignment. Obviously, every conformation will give a slightly different alignment, and it's over time you're going to learn it at what looks reasonably healthy, what looks proper for the dog. But ideally we want kind of elbows below shoulder blades. We want the toes coming in just underneath the pelvis as well. Reasonable angulation. That dog should look as though if you went up and you gave it a gentle kind of nudge at the pelvis or at the shoulder, that it would still be standing. It wouldn't fall over or struggle to rebalance itself. So is everybody happy up until that point? I'm just going to locate my chat box. She says, perfect. Excellent. Is that, for what you guys can see on the screen at the moment, because the chat box has just stayed up, is that interfering with you at all where it is? Oh, now it's bigger. We don't want that. No, okay. I'm going to move it though. I have a feeling it interferes with the recording for some odd reason. So what I've done for tonight is we're actually going to go through a couple of clients of mine, and they've given permission for that, for you guys to have a little view of everything. They're both, oh, hold on, I've got a raised hand. It's always going to be you, Joanne, wasn't it? Let me see. Where's that gone? Perfect. I don't think. Joanne, if you need something, pop a chat, something in the chat box, because I'm not able to draw up the raised hand box for some reason. And so far it's going well. I don't want to tempt fate. Oh, right. So we've got two kind of case studies, and we're going to look at them as if they were in clinic with us. And we're going to kind of collectively start to pick these dogs apart. So Murphy he's an male entire Labrador. He's a grade 7 agility dog. His owners are chasing champ shows. Well, we're hoping to be chasing champ status this year. Sadly, it looks like it's going to be delayed to next year now because of the lockdown. He's what would be considered a sporting fit dog. So he is very lean, very muscular, but lean. So don't let that put you off. And hopefully, my slides, there we go. So this is Murphy. This is his stand from the right. I don't have a left stand. We would normally look at the dog from the left and the right side. So when we're looking at him, he is lean, but not in an unhealthy way. And when you're doing your body condition scoring, you could score this dog as quite low. But when you actually get your hands on him, he has a lot of muscle. He has tons of muscle, to be fair, and it feels really healthy muscle. It's not atrophied. It's not weak feeling. He moves really well as well. There's no weak kind of, when he's fit anyway, he moves quite well. And you've got to take that into account when you're looking at your body score as well. He is somewhat out of condition here in these particular photos because he has been on rest for a couple of weeks. So he has dropped off, but he is usually quite a muscular chap. His head normally doesn't look that big compared to his body. So if you have a look, and we're just kind of systematically going to pick him apart from one body bit to the next. Head carriage, I'd be pretty happy with that. He's got quite a tall head. He's able to, we can see that his neck can hold the weight of his head up well, and B, he's got his neck quite well extended. Coming in down the neckline, he's not kind of roaching. He can keep his head straight. Looking on the shoulders, the side of the body that we can see, this right shoulder, everything's sitting quite nice. One joint is sitting above the neck, so his legs are straight. There's a degree of angulation in the carpal joint. There is, if you look just past the photo, and I don't know how easy it is to see or not, but there's actually a bit of rotation, outward rotation in that left fore going on. And you can just, I don't know if I have, oh, look at this. So just down here, that is rotating out a bit. just a slight rotation, and that's an awful area. We'll see if we can find a better way to highlight stuff for you guys. But that is a tiny bit of compensation happening there, basically. So you're going to keep that in mind. It's something you're going to think about. It might be something that you come back to depending on your discipline. It might be that you're going to start involving multidisciplinary team once we've got a full picture of this dog. But at the moment, we're just going to note it. Left 4, slight rotation. I'd want to know, where is it rotating from? Is it coming from the scapula? Is it coming from the elbow? What joints above that are rotated out? And we can't see it because the owner didn't send me that photo. So if we move to his back, we've got his top line. Reasonably nice. However, we've got this area here where he's roaching a bit. He should be straight. That top line should run to about there before he starts to kind of curl his back under a bit, his back end. Now, even though when we look at him, his legs seem to be in a reasonable position, they don't seem particularly tucked under him, he is rolling his back end down a bit tight. So that's something that I'd be noting down as well. Obviously, in addition to this, we'd be getting our hands on him and whatnot, but just a visual assessment is what we're working with at the moment. Both his hocks appear to be more or less the same height. He does have a bit of rotation on both hind legs as well. If you look to see kind of where they're, where those toes are pointing, and it's possible that that left one might be slightly more rotated than the right. But again, I'd want to look more from that other side. So once we've had a look at him from that side, I'm just going to clear the photo off. We're going to go and have a look at him from another perspective. So here he is from the front now. And she has backed him up against the wall a tiny bit, but we can now see a bit more. So this front left, where we were looking initially, we do definitely have, he's not standing square on it. So we've got either a problem in there or some compensation coming in through it. I've also got this back foot is not equally presented with his body alignment either. He still looks reasonably straight along the spine. So I'd assume, without knowing any different, that from head to tail, he's probably reasonably linear and straight looking, but there's still something not moving or not positioning particularly well within his back end or within this front foot either. That right hind looks a lot better than the left. It probably looks a bit better than it did on the side view. It's in reasonable alignment going from front to back. So if we kind of look at this type of a line here, it's reasonable alignment, not concerning me particularly a huge amount. And then we're going to go to our next one. And here he is from the back. So something that I would hope stands out reasonably quickly for you is right through there. He's super flat compared to the other side. We've got quite nice muscle definition coming in here through the glutes. We've got a tuck, and then we come into the quads there. Whereas on this side, we're really missing those gluteals being kind of pumped out a tiny bit. And we can probably now see a little bit more as well with these back feet. Oops, not well drawn. Back feet are not square up. The legs are probably both in the same position. I don't think any one is more midline or wider based than the other. You should be able to kind of appreciate that roach, that tucking that we had coming through here a bit more now as well, looking from this angle. To me, it looks really round up there, and it shouldn't do. And our muscle mass, it's not sitting as well on the left side as it is on the right. The right's reasonably well muscled and nice looking, and this left side is just not particularly fantastic at all. Probably quite a common presentation for a lot of dogs for us coming into clinic, I would assume, with this one-sided muscle mass. So if we stop there for a minute, so we've just kind of taken him through a stand. Does anybody have any questions? Kelly, good to see you made it tonight. We're able to get in. No questions? Right, we'll carry on then. Oh, hold on. Would we be looking for, right, so question from Karen is, would we be looking for all four legs to be like a table in position? I'm going to assume that's what that reads. Yes and no. They should be square. So the front legs should both be at an even position, providing there's no underlying medical issues that we know about. And the hind limbs should as well. So as long as you're dealing with a square table, then yes, they would be looking like that. Beth, can you repeat that? I think you're Beth, I think you're possibly missing a word in your question there. Let's go back one. Yes, left hind is atrophied. So you're looking through the gluteals, it's quite atrophied compared to the right. Where's my little pen gone? Here we go. So primarily in that area there is where we're looking. I believe on measurements off the top of my head that he was about an inch deficit on that left hind compared to the right. The front legs were not deficit. Which tells me two things. A, it narrows my problem leg down to that left hind, which is fantastic. It makes my job much easier to know what we're dealing with. And it also kind of suggests that it's probably not been going on too long if I've only got this one limb affected. If he'd been left for weeks or months, let's say, because he's still moving well, he's still trotting well, he's still running around. The owner's got 3 other dogs. They've got a new puppy, no issues particularly in movement. He came to me purely because he was knocking poles, but not for any other reason in day-to-day life. So I would assume that he's probably not been suffering for too long. The owner can't pinpoint an exact injury or slip or trip or anything like that for him, but it didn't seem at the time that it was anything that was drawn out. So if we get rid of that. Oops. So here he is in a sit now. Does he look, first thing you want to ask yourself is, does he look straight? Does he look like he's got a bit of lean on? And to me, he looks as though he's got the tiniest bit of lean going on. And it's nothing huge. And if you didn't look for it, you may not find it. But I don't think he's a square. I think he's leaning a teensy bit. That was meant to be an arrow. A teensy bit to the left, just ever so slightly. And if we then follow down to here, we can actually see that this, that'll be his left hind, that left hind is sticking out a bit more. He's bringing it slightly more forward, which means he's reducing the flexion in his hip. Both stifles are quite nicely flexed, no issues there. Balance through the front legs again, looks okay. We've got slightly different paw position on this right fore, which if he's having to reduce the flexion through his hip a tiny bit by bringing it forward, that right fore is going to take more weight and compensation coming through. And in that particular image as well, it might seem as though he's got a bit more muscle mass on the right, and that's probably more likely due to him just leaning and taking a bit more weight there at the time, and more contraction coming through those muscle groups. And then if we go to his side sit, so here he is from the side now, and again we can kind of see he's probably not as close to the ground as he should be. I've probably got a bit of space in here that I wouldn't normally have. And the other thing that's making me think that is the way he's holding this carpal joint, he doesn't have the pads straight on the ground. He's got a bit of extension coming through there that is kind of suggesting that that back end is being held up a bit, and he's just got to increase the length of that front leg to balance him up a bit. And looking at it from that angle as well also tells me that it is most likely he's weight shifting into the right fore quite a bit, and that it's really compensating for him and doing quite a bit. We've also got, possibly, maybe not, it's something you again, get your hands on the dog and have a feel. but maybe through here, and I'll remove that now since it's so messy, but maybe through that area, it's a bit more roached than it should be. He should probably be able to hold himself a bit straighter through there, but he seems to be compensating for some kind of discomfort, pain. It's hard to tell in some of these dogs, particularly sporting dogs, is it a mild discomfort or are these dogs in quite a bit of pain? And here he is from the back. And on the back, we can really see that he's holding this leg in really tight over here. So not only is he not flexing that hip completely, but he's actually bringing that leg quite tight into the midline, adducting it for all intent purposes. And when we compare it to the other side, we can just see from the way that he's holding his rib cage in relation to his stifle, where his stifles are located, that's really pulled in quite a bit. So we've got, in this particular position, we've now got some balance issues because he's going to be, that left hind is going to create a really weak quadrant for him in a sitting position. It's going to be overloading the right fore, which isn't what we particularly want. And more importantly, well, not more importantly, but equally as importantly, around T10, T12 thoracolumbar area, this is where he's going to be transferring that weight. So as he's weight offloading from the left hind through on this diagonal to the right, that area of the back takes a huge amount of the weight transfer. And it's going to start causing soft tissue problems for him in there as well, which is not particularly ideal because it means that we've got more things to be looking at and working out. And those soft tissue issues are probably going to present as spasms, as little ripples through his back. And because we know he's weight shifting forward, they're going to start to track further and further in a cranial location, closer and closer to his head, up through his paraspinal group. And the worse that those are tends to or can help suggest how long these poor dogs have been weight shifting forward sometimes. Right, so I'm going to whiz open the chat box if you guys have any questions with our friend Murphy there. Why can't I find my chat box? There it is. Right, any questions on that little bit there with him? We'll have a chat about. Yeah, Karen, the weight shifting really impacts the spine, not only the muscles around it, but the vertebrae. If you picture the spine almost like an accordion, and every time he jumps or comes off the sofa or anything like that, he's shifting more and more weight through it. So there's going to be more concussion coming through that spine onto the ligaments, the tendons, the muscles, and also the discs that are in there. Would I use TGE? You're going to have to explain, tell me what TGE is. Fur patterns. Yes, yeah, you can do, you definitely can. And that's something that you've got to go back and ask your client, you know, does this bit of fur normally flick up? Does it normally curl or flick up, or maybe it's laying flatter for some reason, maybe the body's really sticking it down. Fur patterns will definitely come into play. I had a dog recently come in. He's a shepherd, and sadly he came in wet because it was raining. But you could see the remnants of a fur change in him, and I'd asked the owner about that, and she had said, yeah, all week it's been facing backwards, and basically all of the fur up along his thoracic area had kind of shifted direction really drastically. But can't see other questions. I think I don't know what the TGE stands for exactly, but they were referring to fur pattern changes in coat changes, line of hair pattern. So yes, yeah, I would definitely be looking at fur coat changes. Obviously from a more physical assessment, you're going to come in and look for all your normal things like heat and tension in skin and in the muscles and all that as well. But I find that a lot of us, and myself included, I don't often pick my dogs apart as probably as much as I should in static positions anymore, because I rely a lot more on my hands nowadays. And I think sometimes it's a bit of a lost art, and there's a lot to be found in there. So just to give you guys a background with Murphy before we move on to the next dog, he had a psoas problem, a left hind iliopsoas problem, which he's still under treatment for. He was presenting with knocking poles, very, very minor. I think one of the other competitors had said to his handler that he didn't look that great on a particular run. The week prior, he had placed first, so the owner wasn't expecting anything too bad. But when we did a full, thorough exam on him, we came up with a left hind psoas problem. And with your psoas, you're either suffering from an injury, so maybe a kind of a slip or fall. It's been really wet this year, or they tend to come from compensation due to secondary, due to other primary problems. So with him being 6.5 and an agility dog, owner didn't initially want to go for x-rays or anything. So we're going to treat, put a time limit on it. And if there's no improvement or not a significant amount of improvement, then she's going to have to go back for x-rays to make sure that we're not kind of treating something that's going to keep reoccurring due to another problem there that we don't know about. Is everybody happy with Murphy? Cool. Right, so George, 15.5 years old. Another agility dog. He's retired. I've treated him, been seeing him for a while now. He had a cruciate problem. I think it was his right hind offhand. Still super duper active dog. His mum's a dog walker. He's out a bit less than he used to be, but he's easily out probably collectively across the day for at least 60 to 90 minutes on and off lead with that as well. So he's just, he's a small crossbreed, probably a 17, 18 kilo dog on the whole. So if we look at him from the front in a nice stand, we can see that his head carriage is pretty good. He's got his head up there nice and high. And as we move down the neck a bit, I can see here that either I've got a coat issue there or I've got a muscle issue, probably a bit atrophied, looking at the difference between that area of his shoulder and his other side as well. That's a lot flatter. He looks as well, he looks thick through here, through the chest. He looks really boxy. They shouldn't really look boxy. He looks heavy, top heavy to me, even though we're not looking at him from the back or anywhere. We've got probably some weight shifting occurring in this foot. He might be weight shifting to this outside edge, this lateral edge through here, rolling the weight through his foot a tiny bit, just looking at the different, in the way that he's holding it. And this one looks a bit flatter. Sorry, this one here looks a bit flatter through the metacarpals as well. So we might have this joint starting to collapse a tiny bit. I would assume that that's more due to age and probably having an agility history than anything else. But it's something that we want to be considering and thinking about as well. So if we then take him from the side, I'm not too sure why she cut his head off. I've got a few where she's cut his head off in them. So from the side, again, that's right fore. So we're over here. He's rotated out quite a bit. He doesn't look completely square through here either. I'll clear that one off, sorry about that. He doesn't look completely square through the back. We've got the right fore. He does look heavy. And coming back to our coat changes, we've got this line coming all the way down through there. Now, some of that is going to be scapula and triceps, but that line you shouldn't see a clear line like that coming down and across the body. You've also got that. That looks like possibly a coat change, but I'm going to assume more likely that is actually a change in his iliocostalis group, which runs from the last rib. Well, it runs longer than that, but we can palpate it easily from the last rib to the pelvis. And it looks like he's overusing that side possibly, and that muscle is getting a bit bigger than it should be. George, I haven't seen for a while. His owner just sent these over when I asked her to the other day for me to use for tonight. So that's what I would pick up on that. He's probably sagging through his back a bit, but you know what? He's 15.5. I'm not going to complain too much. about his top line, he still looks pretty decent. And we've got him from the other side. I think this side, to a degree, actually looks a bit better. That foot, that front foot on the left, definitely flat in the carpal joints. We don't have as clear of a line coming through here either. If you think of how clear it was on the other side, it was probably just slightly in front of that blue line. Maybe I can see something. I might be seeing it because I'm looking for it. I've got a depression in the muscle over here. Just clear that one. You can kind of see where it's coming in. I didn't notice that on the other side. And I'm not seeing as much up here where we were looking at that iliocostalis where it might have been bulging out a bit. There could be the start of something here. I'd need to get my hands on him to know for sure, but that's something that I'd be debating as well. I think his carriage through here is quite nice. He doesn't really seem to be tucking himself under. He seems quite strong through there, but he's really heavy up here. I think you can really see a weight shift coming through him into the front. We can see all this kind of girth coming through him, and gosh, it's an awful pointer, coming through him in that area. And he just, when you look at how trim he is down here, we've got this lovely tuck, we've got this indentation coming in through here as well. He shouldn't be that heavy. When dogs are fat, or even people for that matter, when we're fat all over. When we've got muscle loss or weight shifting that's causing different problems, we'll be thin at one end and heavier and bulkier looking at the other. And that to me is what I think he's got going on. A bit of leanness at the back and a bit of bulk at the front. And here he is from the back. So looking at him on the back, we've probably got some muscle atrophy. Oops. We've probably got some muscle atrophy on that left hind in there, looking a bit flat. Visible atrophy, you're usually looking at least half an inch is present, if not a bit more, for us to visually kind of look and go, that's a bit flat. His tail carriage is nice down the middle between his legs. He's not having to draw it over to one side. His hocks are of equal height. His stifles look to be of pretty equal height as well. I would debate down here whether he's putting as much weight into that foot. It seems like we can see more hair sticking out of that pad, which would tell me that potentially there's not as much weight going through it, therefore the hair is growing a bit longer, or he's just holding it a bit slightly higher off the ground than the other leg as well. And I can't see anything too more obvious on that particular one for him. And here he is from the front. In a sit. Actually, sorry, that's our stand done. Right, any questions for the stand? George's little stand. Abigail, she just said that she just realized taking photos makes such a difference, the little things that you wouldn't have seen. What breed is George? We don't really know. We make fun of him quite a bit. He's quite a small little guy. We're assuming there's probably some Kelpie in there, and then something with a long back. Couldn't tell you what though. He's just a really, really good crossbreed. With my sporting people, the first time that I'll see them, I will take these series of photos normally, or I'll get them to take them and ask them to keep them on their phone. If I see things that really interest me, then I'll take them myself as well and keep them for my own records. And as we go through the rehab process, maybe every 3 to 4 weeks, we'll repeat the photos so that they can visually see the change that's happening in their animals. And the other reason that I take the photos and get the owners to take them, particularly themselves, is that they then have a baseline. So when we reach full rehab and I'm putting these dogs back to sport, we're going to photograph them again. And they've now got a baseline to work from. This is what your dog should look like when they're sporting fit. And if you kind of whip these photos out and maybe photograph them every 10, 14 days, or after a big competition, or after you think they've done something, then we can at least kind of be considering, you know, can he hold the same position? Can he not? Do we need to call the physio? And the other bonus, aside from the treatment side for the dog, is I really find that once they've come and seen me and we go through the photos, then they go out and start showing all their friends what's wrong with their dog. And then their friends start looking, and then their friends start calling me as well. So it can be a really nice kind of marketing aspect without without really having to do anything, because all we're doing is providing some really good education to the owners, and they're sharing it all for us. Right, so we'll work through his sit now. So George's sit, we've got all kinds of things going on here. We've got this foot is coming forward, this foot sticking out. I can't really see what that one's doing, but I'm sure it's not in the right position. We've definitely got that muscle atrophy up here. You can see that probably a bit more clearly for the position he's in at the moment as well. So with this foot over here, this hind leg here, he's not particularly pulling that stifle in as tight. It looks like, position-wise, it looks like he's probably got some reasonable hip flexion going on in there. I'm pretty sure, with that being his left hind, that's the one that we did a conservative rehab on his cruciate. It was only about 18 months ago, and the owner really didn't want to anesthetize him with him being around the age of 14 at the time, so we went conservative. And everything's happy and stable now. But I would assume that a bit of scar tissue buildup has probably reduced the range of motion. And we were suspicious of the other one not being completely stable, but we kind of just treated both at once. So that could also be part of the reason for him not managing particularly well on the other foot. And it could also play a role in this forward weight shift that we're seeing with him as well. The flattening in the carpal joints, probably a mixture of all kinds of things. Long-term agility dog, carrying this weight forward for a while as well. He was retired when we treated him for the cruciate, but we don't know how long that had been lingering around for him. He had a bit of a slow decline, and the owners and the vets had assumed it was just arthritis, so he was on medication for about 8 months before they came to see me, and that cruciate was quite well deteriorated by the time we came across it, so that this weight shifting has probably been going on for quite some time in him. So look at his next one, and there's a close-up of his legs. So we've got a huge desire on his left hind. We'll start with the left. So this one is his left hind. Is that hip? He may not want to be pulling this leg particularly close into the body because of the hip. He's essentially adducting the hip at that point. It could be a stifle issue. It could even be a hock or foot issue if he's not keen to put too much weight through it. A good examination is what's going to tell us. It could be old age as well. It could be muscle weakness starting in through the adductors, and they're just not able to, he's not able to put himself into a sit and keep his feet underneath, maybe some reduced proprioception in there as well. And then on this right hind, which is that one, I'd probably argue maybe a slightly different problem, not wanting to flex that stifle. He's really kind of rolling that, again, that stifle and that hip out to avoid a degree of flexion in there. So maybe we're looking more of a hip arthritic-y type problem, lumbar sacral problem coming in through there. Maybe some reduced range of motion in the stifle from conservative repair if it was bugging him a bit at the point that we did the other one as well. So again, a fair few things to be looking at and kind of thinking about when you're doing these assessments. And here he is from the back. So he's pretty straight, which is nice. We've now got a better view, and I would argue I've probably got right there would be that bit of iliacostalis muscle that is probably just starting to bulge compared to that side. That blue dot doesn't show up as well. Hopefully you guys can see it. Just slightly different shape. It could be a bit flatter on this left because he's not tucking that foot in as well, because he's not able to hold it in as well. Tail is still nice and straight, so he's not having to use it to balance himself or pull himself over. And obviously a physical exam would tell us a bit more. And then coat change again. We've got this rough kind of coming over his shoulder blades up there. And you can still see just there running upwards through there, just in front of that line coming through the coat again. So he's definitely got a huge tension pattern running through there. And that's going to be because of, again, this diagonal kind of weight shift from the left hind coming forward to the right. in addition to stuff like that, we're going to be looking at feet position, top line, overdeveloped muscles, body shape, and body shape is best looked at kind of bird's eye view from over the top of the dog. Any kind of offloading, joint rotation, height of joints, is everything even or even, not evil, even, are the carpal joints at the same height, or is elbows, stifles at the same height, overextended or overflexed joints, and any kind of a lean that they might have as well. All right, you guys happy with George there? Perfect. Which further assessments would you do having seen the posture of the dog? Okay, I'll deal with that question in a second, Melissa. I'll just see if anything else comes up. So at assessment perspective, I'd look at it from a few different ways. I'd definitely be looking at his psoas involvement. I would assume I've got some psoas involvement in there. I would assume that I've probably got a load of soft tissues in there. The coat is telling me that. From my perspective as a physio, I'd be doing a pretty thorough soft tissue assessment of him. I'd be doing a pretty good orthopedic joint assessment on those hind limbs, particularly. The front legs. Right, I'll come to your question in a minute, Alexa. The front legs, they look pretty good, but he's an old dog, so again, a good orthopedic exam through the front, and I'd be looking for some basic neuro stuff as well, flipping the foot over, sliding a piece of paper under the foot and slowly drawing it out to look at proprioception, and just trying to kind of figure out, are we dealing with more of a skeletal problem, or are we dealing with more of a muscular problem, because that is going to change, or not muscular, sorry, a neurological, because that is going to slightly alter my treatment plan when I start putting it all together for him. Does that answer what you wanted to know, Melissa? And then I've got Alexa asking, does sitting on the tail indicate anything? Like George in the sit from the rear view picture. It can do. With George, I don't particularly think it does, but it can sometimes suggest that they're not able to move the tail out of the way quick enough. Most dogs, it's a good observation, because most dogs don't like to sit on their tail. Maybe some weird fluffy dogs, collies, retrievers, things like that, you might see them sitting on the tail occasionally, but his was quite tucked under him, and you could have, again, proprioception, or maybe he's trying to create a bit of comfort in there, rolling his back a bit tighter, and bringing that tail underneath him just helps him achieve that degree of comfort for him as well. So it is definitely something that you should be considering. And for me, I'd probably be assessing that by having the dog in a stand and gently moving the tail left, right, up and down, and looking at the dog's reaction and seeing how he felt about those direct movements, those isolated movements. Is that okay, Alexa? Perfect. All right, so we'll carry on. So here's those iliacostalis muscles that I was telling you about. So this is a great big one here, bulging out, and he's got the start of it over this side as well. This is Scooby. He's an American Cocker Spaniel. And that's Scooby. That middle photo is Scooby from a bird's eye view as well, so you can really kind of see that they're there. And then this is Bella. She's an older Jack Russell, and she's got just in there, you can see the start of it, and her owner's very, very, actually to be fair, both these owners are extremely observant, but Bella is still very, very active for her age, and we actually gauge how well she's doing on the development of those muscles there, because we keep them at a minimum, and every month I get an email from her or a photo from her owner, and we have a look at them and we adjust treatment plan accordingly based on what those are showing. So quite a useful little group. I do have a lot of owners that come to me saying that the vets have just told them that they're lipomas or fatty lumps, and not to worry about them. And 9 times, I've had a few that they were genuinely fatty lumps, but a lot of the time it's actually a lump of muscle, of overworked muscle. So always have a good feel of those if they look like they shouldn't be there. take the time to have a feel. Oops. Here's another dog in a stand. This is a little pug, 2 years of age, maybe, thereabouts. Oh, hold on, I might have a question. I'll just check. Possible, okay, so Lisa's just asked possible conditions causing this overwork of this muscle. Don't be sorry. So that muscle group is quite a big one. It's part of the paraspinal groups, and it runs along more of a lateral aspect of the body. And you can actually see it. She's got, I'm just going to use her while she's here. She's got, this is it here. She's got a really nice layout. You can just see the definition of it inside that blue line. And we palpate it from the last rib through to the wing of ilium, through to the pelvis for the most part, and you can start kind of at the spine, and it rolls around as really thick. So I'd be working with it through there, really. That's kind of the depth of the muscle there. And the main reason that these tend to start overworking is because they shorten the stride on the leg that the bulge starts. So these are the dogs where you see them kind of throwing their hips a tiny bit. And we look at this specifically in next week's lecture, the movements that now start creating these kind of problems for us. So yeah, this is something where I'd be looking at this dog kind of shortening a stride on a hip, or elongating a stride so it doesn't have to be on the ground as much. And they're really going to kind of flex and bend that right side, which is going to contract that muscle in and out more, with more strength and pull than it is on the other side. Is that good? Right, so we'll come back to Molly. Oh, yes, perfect. So Molly, she came along to a physio session with another dog that the owner has, and we sent her from my room to the vets. And we sent her from my room to the vets primarily because of this roach and because of her breed type, and because, I really wish I could draw with this thing, because of this double curl in her tail as well. So when we breed these brachycephalic guys, obviously we're impacting the spine a huge amount. And up until now, this is probably one of the most muscled pugs I've ever met in my life, this little dog. She's really lean. She's usually quite well muscled. She's been, at this point, because the other dog's been on restricted exercise, I think her walks had downed a bit, so she's not as defined in muscle. But that double curl on the tail, from a genetic perspective, is not particularly desirable in the pugs, because it can suggest a higher rate or incidence of spinal problems. So that was something that from day one, we made sure that the owner had a good insurance policy, and kind of gave her a rundown on different things to be looking for. And she brought her in this night with her, just for me to have a quick look. And we didn't even look, to be honest. I took a photo and whizzed her off to the vets. So we've got this roach in the back. We've got her back feet are really tucked under. And we've got a lot of extension through these hocks. They're really, really straight. And you can also see this really clear forward weight shift. Her front legs are having to come in. Her neck is really extended here as well, and she's balance-wise. I bet if we gave her a little nudge on the back end, she'd probably stumble a bit and struggle to maintain her balance with that. Not at all an ideal position for any dog, but certainly let alone one of these brachycephalic breeds that are prone to spinal issues. The vet started with cage rest and non-steroidals, and I last saw her just before we all had to lock down, and she was looking a lot better, so I was quite pleased. But I would suspect that at some point I'll be seeing her possibly for more serious problems, sadly. This is Charlie. Charlie's not a very good example of a dachshund, I'm afraid. I put him in because whilst, you know, for a dachshund, he's got reasonable posture. I think some of these breeds, it's hard to know what the norm should be, because we've made them so awkward looking in the first place. But the reason that I popped him in there, oh, hold on. Claudia, I've just seen your question here. I'll come back to that in 2 seconds. Sorry, I didn't see that before. So yeah, the reason that I've popped him in here is because you know, he's not that bad. He's probably a bit low in his hocks. He has actually had spinal surgery, believe it or not. He's had, I think, 2 discs removed. I didn't deal with him through that. I've dealt with him now at the moment because his owner's panicking that his back is going to go again because he's so obese. So we've put some exercise in place, and really we're dealing more with the owner in this case than Charlie. He's pretty keen to walk and move. She just wanted to get him mobilizing again properly. But sometimes we've really got to aim our photography to show things that owners don't want to see or admit. And this was one of those photos that, you know, we had to come out and go, his clearance is nil. His belly is rubbing on the ground. Ideally, if he was on carpet or anything, where his feet sunk into it slightly, it's going to have a welfare impact on his stomach, let alone his joints and his spine and all the weight that he's carrying. So that was the main reason that I popped him in there. He's probably sagging a bit in the back. His hocks are a bit low. You can see these elbows in this front leg through, my little pen's gone, through here are really, he's really holding them tight against the body. So he is probably weight shifting because of this existing spinal issue that he's had. He's probably taking a lot more weight through the front, definitely, than he should be. But a degree of that is also obesity. It's not just a top-heavy dog. It's not just muscular overuse. We do have an obesity issue there as well. Right, let me clear that. So I just found a question from Claudia there, and she was asking, what would the coat changes suggest? So we're going back to those coat changes that we saw. And what you guys want to look into within the equine world is probably the best place to find them. The things exist that are called fascia chains, and the equine people have, and the animal osteopath people use them a lot, and they've outlined them quite well. And these fascia chains, there's, I think, 6 or 7 different patterns it can create across the body. They represent how the fascia and the muscles kind of compensate for different pattern movements and compensatory movements within the dog. So those coat changes would be representing a dysfunctional fascia chain somewhere within the body. And that particular one on the side, there is actually a fascia chain that works through that area. I couldn't tell you the name of it offhand. I do use them, but I'm still living in a world where they sit in a textbook or a notepad beside me when I'm looking at them. But if you guys have a bit of time, which I'm sure we all do at the moment, having a bit of a read up on equine fascia chains, and we've translated them over to the dogs basically like for like. Just pop that there. Right, so this is a chap, he was in my treadmill. And obviously from a stand position, I've got this rotated hock, which was something that caught my eye. He actually came in. He's an agility dog as well. This is the hock here, rotating medial inwards. And he came in to for fitness. He'd had his right cruciate repaired 4 months prior, and the owner wanted to put him back to fitness to start running agility that season. And this was his first time in the treadmill. And you can see as well, this foot is not taking as much weight. He is in a stand in this, he is not treadmilling. So I've got that foot not taking as much weight, and these front feet up here. To be fair, none of these feet are flat on the ground. They're all, he's holding himself a bit high, which tells me that he's you know, compensating and weight shifting off this left hind. And he had a ruptured cruciate. And it's useful for you guys that do treadmill work. When we put a dog in the treadmill with a cruciate problem or a fusion in the joint as a bare minimum, they do often go lame because of the compression of the water. And because their feet are on the ground, they can't kind of dislodge the pressure within that joint off. So if you do have that type of an issue that's undiagnosed at the moment, popping them in the treadmill can often heighten it and highlight it immensely. And I've sent a lot of dogs off for x-rays long before they looked rubbish on land, and found that we've got an early cruciate problem going on. So if you see those changes in the treadmill, take note of them. No, Beth, you won't see that on swimming. The only time you'd see it in the pool is if you're using pods, or if you've got a ramp, a level ramp that's deep enough. So you'd need the water. I tend to see this primarily, let's see, my water level would need to be at least, that's probably a bit low actually, I'm going to clear that, at least around there. So probably a good inch over the stifle is where you start to see this, and you start to see a lot of double stepping, weight shifting back and forth, just almost like a mild agitation. They don't want to stand still. They can't stand still. Some dogs will just circle the treadmill, move back and forth, weight shift, pace almost the perimeter of the treadmill a bit. And if you do a lot of table work in your pool and have the dog static standing, then yes, you can see it in a pool as well. If you don't do that, if you just literally have them on a ramp that's not level and into swim and then back on the ramp again, then it's unlikely you're going to see it, because you don't have the pressure that's created with them being in that functional position of standing. Oops. Back down. There we go. So our next one. This one, another static stand in the treadmill. This was a really old Labrador, but we've got a collapsing foot there. Sometimes you can do stuff for these. Sometimes treadmill works really well. Swimming, I find, tends not to work as well to tighten these up. If this collapsing is due to a bit of muscle laxity and atrophy, then increasing tone and strength and muscle mass will tighten those feet up a bit. However, the way that this one's looking, where these toes, not only the foot, the carpal or the metacarpals, but the phalanges, the toes are very flat as well. We've probably got some arthritis or ligament issues in there. And I tend to, obviously at that point, we're looking more at exercise modification, pain medication, probably some wheat bagging and stuff like that to keep a dog like her a bit happier. Hold on, we got a question. Wheat bagging. Okay, so your bean bags that you pop into the microwave and you heat up a bit. From a physio perspective, we will often use what's called thermal therapy, so either ice or heat, to deal with soft tissue problems. Oops. Here's our next one. This is another agility dog. She actually came in. She was an odd one. She still is an odd one. She came in because she was panting at night, and the vet said she was fine. She'd been off to referral, been through 2 orthos and a neuro guy, and then owners still weren't happy. She was on a lot of pain medication as well that didn't seem to be doing anything. And we have this left lean, and she has something going on in her hip. This is 12 months going. We're still waiting on a diagnosis. I'm curious if the dog has like a bone-on-bone situation in the hip joint itself, so that the femoral head is against the acetabulum and is wearing away the cartilage or something, because her x-rays are very good. But her body and her behavior and her pain levels tell a different story. This is a dog that one of the very, very few that I've actually had to muzzle to work with some days because she's in so much pain. So it's a really odd one, and it's been really hard to get the vets on board to try and believe that the dog is as bad as the owner suggested is, because they're just not, I don't know, they're just not believing. So she's now on referral vet number 3. And sadly, we've ended up in lockdown now. So I think everything's been put on hold yet again. But it's probably a reasonable, we look at the dogs very differently to the way the vets do. We have a lot more time than the vets. You know, I'm running a 45-minute consult. I see these dogs in and out weekly a lot of the time. My sporting dogs, these owners can provide me with video and play-by-play movements on their fitness and their mobility. And I think sometimes we can find a lot of things that the vets just overlook or oversee or dismiss sometimes as well. Hold on, we've got a question. Oops. is the right tail position balancing the left lean or something else? No, it's most likely balancing that left lean. I don't think it's doing anything else. The tail wasn't particularly moving at the time either. Dad does have a treat in his hand as well, and Dad's actually holding that treat center. So in theory, that should encourage the dog even more to sit dead center in line with that treat. And for whatever reason, this dog still seems to have the need to lean, which from my perspective tells me that there's probably a lot of pain there, because that food motivation, and particularly in an agility dog, should override a bit of that pain, and they might sit that bit better. But you can tell that we've got the lean. We can see it, particularly in this dog, but we've also got along the line of the feet. Where's my little pen gone? I can see more of this foot. I can see more of this hock over here on the left, and that tells me that we've got this lean going on. And if I had somebody that came to me and said, you know what, it's just the owner holding the treat, then I'll say, right, you know what, either A, give me the treat and I'll square the dog up, or I might do it 3 or 4 times and just look at the majority. If out of 5 times this dog is going to sit in that position with this lean, 3 out of 5, it's doing it for a reason. If it happened the one time and not again, then I'll blame it on the treat. Porch, I've got 2 questions here. First one is, oh, no, I've got more, hold on. Would I send my pictures off to the vets to highlight my findings? Yeah, I will send photos and videos off. I also send the owners with the photos and videos, because we all know that sometimes these reports just sit in the email box, or the receptionists upload them and they never get to the vet. So I always make sure that both the owners and my report goes off. And with my caseload, for a lot of them, I will report back probably every 10 sessions or so. But for some of them, you know, even with this dog, if I'd done a report the last time I saw the dog and then this came in, or she came in looking like this, they'd have a report right away from me. Because I'll be saying, look, anytime I say to my owners, you're going to go from me and I want you to make a vet appointment, then those vets are going to get a report out of me straight away. And the next question I have is, you mentioned that panting was what had concerned the owner. Is panting a common sign for pain? Yeah, it can be in some dogs. Every dog is going to manage it differently, just like every person manages pain differently. But for her, she was really restless. She was panting day and night, just laying and panting. And whilst it was warm, the owner's in shorts, we know this is summertime, it wasn't warm enough to warrant this dog to be panting the way that she was. Let's see who's next. Huh, someone's already drawn on this one. There we go. So this is a Shih Tzu. Charlie, he's called. And again, I've got slight under this foot here, an offload. He's not loading into that foot properly. More than enough reason to go and have a look. He was actually coming to me for treadmill work. He'd had patella repairs a couple of years prior, and he had come in. The referral for him was that the owners had dropped off their exercise during the winter because of the shorter days and longer nights and all that. And the vets specifically wanted treadmill work to rebuild the muscle mass. And we started with a bit of that, and we weren't particularly getting anywhere. And an initial exam didn't give me a huge amount. He wasn't particularly in pain or discomfort. But after doing some soft tissue work and some muscle massage work, we found that his patellas were actually still luxating, and the surgery had failed. Prior to that, everything was moving fine. Well, it wasn't moving fine. Prior to that, he was holding everything really, really tight. And because he was holding it tight, everything looked really stable in there. So I didn't have we didn't initially have the ability to find that luxating patella. We needed the soft tissue work to come in, release the quads off so that patella started luxating again. All right, I'm just going to have a quick check. I think I've got, oh, right, there we go. And this is another dog that went through hydro. This one was actually a difficult one. Oops, don't do that. There we go. So this dog, again, been through referral, been through vets, couldn't find anything wrong with it. Owner was excellent. This owner came with a diary, a minute-by-minute diary of this dog's life, of what it could do and what it couldn't do, and how its life had changed in the previous 6 months, and it was so useful. And with this dog, so we've got this roach coming through the back. We've got all these coat changes, tons of coat changes all through here as well. You can see this top half up through the neck area, neck and shoulders particularly, is lovely and flat, beautiful looking coat. And then as we come all through down the back and closer to this lumbosacral area, we've got more and more coat pattern changes coming up, which is going to be due to muscle disturbance underneath the skin and our fascia patterns. And in the end, we sent her back to the vets and kind of nudged them for a bit of imaging, MRI preferably, which they did do, and they found a couple of bulging discs in her back. And for me, the big giveaway was the way that she held her hind feet, which is here. She's not even sitting on them. You know, she's just shifting them forward. She's sitting more probably on the base of her tail and her pelvis area, as opposed to these feet. They're not taking any weight, which means that she's not taking any pressure and weight, particularly through the limbs and into the pelvis. She's just totally offloading that back area. And the other big game changer for this particular dog, information-wise, was that it could walk all day long. It didn't particularly fatigue. If it went out walking in the morning, this owner could do half hour, 45 minutes without too many problems. And it was the dog's fatigue actually came in as the day went on. So by the end of the night, she noticed that this dog was quite badly fatigued. No lameness particularly, which is more how a neurological problem tends to work. The body fatigues, and dogs realize they can't achieve it. So by the end of the day, she wouldn't try to put her front feet on the windowsill to look out the window. She'd just give up and not even try. Whereas a dog with hip problems, let's say arthritis, will keep doing that. The excitement, something to look out the window, overrides the pain response, and they'll still do it. But she didn't even try anymore. So we were quite pleased to get an answer. And part of the reason that it was difficult to find her problem was because she was so well muscled. The owner, from I think about 4 or 5 years of age, had been swimming this dog at least once, if not twice a week. And the hydrotherapy had masked so many problems, so much of the deficits that we normally would have seen in the majority of our dogs. So we really had to dig deep and look for lots of tiny little signs with this one. Right, so as a summary for tonight, your postural assessment, it's every aspect of the body. You've got to look at these dogs as a whole, and then along each body line and joint line, and certainly getting your head around your fascia chains is a useful thing to be doing as well. Every time you see your dogs, you've got to consider pain. Even if you see them on a week-to-week basis, we've always got to be wondering, are they comfortable? Are they in pain? I have a lot of therapists that'll come up and tell me, you know, they can't be in pain. The owner said they were fine. But then you see these dogs that are leaning and struggling and top heavy, and you just think, well, they must be sore, because why would I lean like that? It can't be comfortable to lean. And use your photographs, use your phones. I'm assuming most of you guys have this stuff in practice with you. The other thing that I use my photographs for, and it's not just photographs of patients, but I carry my iPad with me, and I've got a whole rife library of anatomy photos in there. So if I've got to talk to somebody about a cruciate problem, our vets don't always have time to take them through the ins and outs of it. I've got a photo in there of a stifle joint, and I can show them and explain to them what's going on in the joint and what goals we want to achieve through treatment, hydrotherapy, physiotherapy, whatever kind of discipline that we're working from, so that I can get the owners on board working with me a bit more. Does anybody have any questions? Oh, we've got something there. Nope, no questions. Perfect, that's us for tonight then. You've got, next week is our last one for Gait. We'll start a new topic after that. And we're looking at dynamic movement. So we're back to video, hopefully video that's not going to crash this whole thing again. And I'll see you guys next Sunday at 7. PowerPoint, video recording, and CPD certs I'll be sending out throughout tomorrow. So if you don't have something by about 5, 6 o'clock, let me know. And a few people have just said that they didn't get a CPD cert from the last one. Whiz me an email. And if not, I'll see you guys next week.